Okay, everybody, welcome back to the show. Big topic here today, maybe controversial, and that is deciphering lymphedema versus cellulite and how to tell the difference. So many women come into my practice. Our practice is probably about 70% women, and we work with women all over the world. Now, this is never, I've been in practice a long time, over 25 years, and this has really never come up. It's honestly just the last year or so, maybe 2 years, because of social media, making this a little bit more prevalent, this topic. But a lot of women are coming into our practice saying they have lymphedema. And I'm going to share with you in just a moment, so you'll be able to figure this out for yourself, no doubt about it. We've got a little assessment right now if you have cellulite or you're starting to get lymphedema. And I think the problem is that too many people have been given the wrong diagnosis, or they're leading women in the wrong direction. I want to go over this right now, make sure that you are on pace to be able to fix whatever you're dealing with right now, but not through misdiagnosis. All right, so here's what I want to get into. What is cellulite? I've got a bunch of shows on cellulite, and I'm going to link them up. So head on over to stevencabral.com/3511. The reason why you want to do that is I'm going to give you, they're all free, the previous shows on cellulite and how to get rid of cellulite, okay? So I want to go through that. A big part of it is reducing toxicity, reducing overall inflammation in the body. I'm going to share that on previous shows as well. And then, of course, great things to do, such as dry brushing, etc. Okay, but here's what we want to look at. Cellulite, if you're not familiar what it is it does affect about 9 out of 10 women. So about 90% of women, by the time they get into their mid-30s to early 40s, 9 out of 10 women will have at least some cellulite. Men do as well, but it's far less prevalent. So that is why I don't see most men coming into my practice asking if they have lymphedema or cellulite. It's mainly women, and that's because it just affects women to a far greater degree. And what it looks like, if you're unfamiliar, is that it has that orange peel effect that a lot of people refer to, where there's a dimpling, and that is because the fat deposits are actually pushing through the fascia or the connective tissue. So basically, if this is the fascia, if you're watching this on video right now, is that some of the fat will push through. And so you actually see little dimples of the fat, that is the fat moving through the connective tissue. So our job is, one, we're going to reduce the fat, we're going to reduce the inflammation, we're going to improve the connective tissue. That's essentially how we get rid of cellulite, right? So this is important because genetics is part of it, losing muscle mass is part of it, hormonal shifts, so reduction in hormones as well, or an increase in estrogen dominance could be an issue, overall poor circulation, low thyroid, and being more sedentary. You're just literally not getting the blood flowing as well. All of these things can worsen it. And then, of course, as women move later in life, that includes men as well. So this is important because lymphedema will look somewhat like that, and that's where there's confusion. It will look like dimpling as well. But there's a big difference. Cellulite is not a medical-based condition. It's cosmetic, right? And so although nobody really wants it, that's for sure. I don't know anybody who does want it. The issue is lymphedema is a medical condition, right? So you'll be fine if you have to live with cellulite, but with lymphedema, not so much. And this is why it is, again, I love social media because it gets the word out about so many things, but many women are diagnosing themselves with lymphedema, and it is anything but that. So let's go through what lymphedema is. So it is a medical condition literally defined as or caused by the impairment of the lymphatic system. So let's just take a step back. What's the lymphatic system? So our lymphatic system moves through our entire body. It's like the blood, but not. The lymph moves around all of our cells. It takes the waste. It has white blood cells. It moves them to lymph nodes, like in our neck, our clavicle right here, our armpits, our groin, behind the knees. These areas are essentially cleaning sites for viruses, bacteria, pathogens, etc. Right? So sometimes you get a cold, a virus, bacterial infection, a lymph node will swell. All right, well, that's a good sign that there is downstream some infection that the body is working on. Okay, so that's the lymphatic system. Well, with lymphedema, that lymphatic system gets cut off. There's a blockage in some way. So a lot of women, they'll mainly say, I have lymphedema in my thighs. Okay, if you have lymphedema in your thighs, that means then there is a blockage typically upstream. So here's the other interesting thing about the lymphatic system. It's essentially a one-way street. So it moves always towards the heart, or basically really towards the upper left quadrant of your chest. And that is its way out of the body. That's literally where it needs to go. And that's why movement is so important. It really is that your body is going to hold fluid. It's going to hold water if you don't move your body. It's one of the main reasons why the 7,500 to 10,000 steps a day is so important. And even putting the legs up on the wall at the end of the day, just to move that fluid back down out of the legs, especially if you sit or you cross your legs during the day. Really important that you just walk, that you walk in essentially pretty flat-soled shoes or barefoot to be able to get that gastrocnemius, your calf muscle, pumping the fluid back up. Okay, so what women are saying when they have lymphedema is saying, I've got a blockage somewhere in the groin section of the lymph nodes, and that then is not allowing the fluid to flow back up to my heart, and so now it's stuck in my thighs. Okay, luckily that's not the case. That's not the case for probably 99 out of 100 women. And why that's important is that that is dangerous and a medical-based condition. If you really do have lymphedema, you need to see a doctor. I mean, that's the real truth. This is a medical-based condition. So here's other things to differentiate versus cellulite. Because again, it can look dimply. There's no doubt about it because you're holding fluid. But the skin can actually start to look thicker, or it can get hard or painful to the touch. Cellulite is not typically painful to the touch, okay? Lymphedema, it can get hot, it can be swollen, dark or red. I mean, think of it as like an infection, and it can be painful to the touch. All of those things are absolutely part of lymphedema, and it can unilaterally affect one side more than the other. So if you're walking around and one thigh is 2 to 3 inches larger than the other, okay, there may be a venous-based issue, so the veins, or the lymphatic system, because sometimes it's not just the lymph. Like the lymph is different than your vascular system. Some individuals, as they get older, their veins become leaky. They become weaker. Part of it's sedentary, part of it's hormones, etc. So we want to differentiate because there's 3 main things. We're not going to talk about the venous-based system today. I'll talk about varicose veins in the venous system and how to fix that in the future. But right now, let's stick with lymphedema. So if you do see one leg or one part of your body visibly far swollen than the other, okay, yeah, that could be lymphedema. Go have that checked out, no doubt about it, because lymphedema is often one-sided. Here's when lymphedema does actually take place a lot of the time. One is that there's an injury or there was a surgery. So let's say someone had surgery on their hip, or let's say a woman had breast cancer-based surgery and she had 2 of the nodes removed in the armpit-based area. Well, there could be fluid buildup below the shoulder, and that could actually be real case of lymphedema. Okay, we need to open back up the lymph-based channels because if it's cut off, right? So you want to be able to do things like gua sha or foam rolling or dry brushing or Iyengar self-massage. All of those are great. But if the lymphatic system's literally blocked, well, those aren't going to be as helpful. So this is why it's important to understand that will be amazing and work very well for cellulite, but for lymphedema, not so much. All right, so hopefully this was helpful. Again, they're both holding fluid. They're both dealing with inflammation, but cellulite is cosmetic. It is dimpling of the skin. It is fluid retention. There's no doubt about that, but it's different because it's not blocking the lymphatic system. And when you block the lymphatic system, you're often going to see the thicker skin, the tighter skin, swelling, usually unilateral on one specific side, and it can often be painful or hot to the touch. Hopefully this was helpful, everybody. Appreciate you. I'm going to link up my previous cellulite-based podcast, how to eliminate cellulite, how to test for certain types of inflammation which could be causing that cellulite, and your hormones, which is the stress, mood, and metabolism test. You can find all that at stevencabral.com/3511. Take care. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.